Hello everyone, my name is Sam. I am a nutritionist GP. Welcome to my nutritional presentation today. Today's topic will be on vitamin B6. As usual, before I begin my presentation, I just want to show my disclaimer. In prior presentation, we have already discussed vitamin B1 to B5. Now we will move on to vitamin B6. First, we will begin with an overview. Vitamin B6 is a water-soluble vitamin. It is actually the generic name for 6 different compounds with vitamin B6 activity. There are 3 basic forms and 3 active forms. The basic forms are 1. Pyridoxal or PL for short, 2. Pyridoxine or PN for short, and 3. Pyridoxamine or PM for short. The active name for the active coenzyme form for pyridoxal is pyridoxal 5-phosphate or PLP for short. The active form for pyridoxine is called pyridoxine 5-phosphate or PNP for short, whereas the active form for pyridoxamine is pyridoxamine 5-phosphate or PMP for short. As you can see, the active form as compared to the basic form has an additional phosphate group. The most common form of vitamin B6 in human and many animal tissues are the PLP form as well as the PMP form, whereas plant foods contain primarily the pyridoxine form as well as the PNP form, and they exist in what we call the glycosylated form, where they are attached to a sugar molecule, which make them less bioavailable or less easily absorbed in the small intestine. The active form of vitamin B6 act as coenzymes, and these coenzymes help enzymes to carry out many important chemical reactions within the body. As mentioned earlier on, the 2 common forms of vitamin B6 in human and in many animal tissues are the PLP form and the PMP form, whereas plant food contains primarily pyridoxine and the PNP form. When we eat our food, the active form or the phosphorylated forms from the food that we eat are being dephosphorylated in the small intestine to release the free basic vitamin B6 form. The free form then is being absorbed by the small intestine, specifically the jejunum part of the small intestine, by passive diffusion. Absorbed vitamin B6 then goes to the liver, where they are again being converted back into the active phosphorylated form. Being a water-soluble vitamin, vitamin B6 in excess will be excreted from the body via the urine. Just like other water-soluble vitamin, vitamin B6 is susceptible to damage by heat, light, and oxidation. Vitamin B6 is important in many ways. It is involved in a wide variety of metabolic functions. For example, it is involved in more than 100 enzymic reactions within the body, mostly related to protein metabolism. PLP, for example, is involved in the metabolisms of carbohydrates, lipids, and amino acid, whereas PMP is involved in amino acid metabolism. Additionally, vitamin B6 is also involved in a process called gluconeogenesis, where sugar is being manufactured or glucose is being manufactured from other organic molecules within the body. It is also involved in a process called glycogenolysis, where sugar storage in the liver and the muscles is being broken down to release glucose back into the bloodstream. Other functions of vitamin B6 include its involvement in the development of cognitive function, specifically the production of neurotransmitters. Other important functions include maintaining a normal level of homocysteine, an amino acid as well as an inflammatory marker in the blood. Vitamin B6 is also involved in immune function. For example, it promotes the production of a white blood cell called lymphocyte, as well as an inflammatory mediator called interleukin 2. It is also involved in the production of hemoglobin within the red blood cell. Additionally, vitamin B6 has also been found to be protective against the development of colorectal cancer. In two prospective studies from Physicians' Health Study and Nurses' Health Study cohort, both men and women who have a higher level of PLP in their blood and a higher level of vitamin B6 intake is found to have a protective effect on colorectal cancer risk. This result remains even after adjusting for intake of other nutrition such as folate, multivitamins, as well as methionine. Another function of vitamin B6 is its role in relieving nausea and vomiting related to pregnancy. In fact, the American Congress of Obstetrics and Gynecology recommends 10 to 25 milligram of vitamin B6 3 to 4 times a day to treat nausea and vomiting in pregnancy. In more severe cases, a combination of vitamin B6 and doxylamine, which is an over-the-counter antihistamine, taken together and preventatively before symptoms started, has been shown to be very effective. Next, we will move on to discuss what happens if we don't have enough vitamin B6. In general, isolated vitamin B6 deficiency is uncommon. If vitamin B6 is low, then other B-complex vitamins such as vitamin B12 and folic acid are likely to be low as well. Causes of vitamin B6 deficiency include kidney diseases, as well as digestive disorders causing malabsorption. These include celiac disease, Crohn's disease, ulcerative colitis, certain genetic disorders such as homocystinuria, as well as some medications such as anti-epileptic drugs. Generally, individuals with borderline vitamin B6 or mild deficiency may not have any signs or symptoms for months or years. However, as deficiency progresses, vitamin B6 deficiency can lead to significant biochemical changes within the cell that become more obvious over time. These changes would include skin changes, for example, dermatitis, which is skin inflammation, with cheilosis, which refers to the scaling on the lips, as well as cracks at the corners of the mouth, and glossitis, which refers to swollen tongue. If untreated, it can lead to blood changes, for example, microcytic anemia, which refers to low hemoglobin within the blood, as well as weakened immune system function. Further changes can occur that involve the nervous system. These would include depression, confusion, irritability, and even seizures. So where can we find vitamin B6? The richest source of vitamin B6 include fish, beef, liver, and other organ meats. Starchy vegetables as well as non-citrus fruits also contain significant amount of vitamin B6 as well. In Western society, cereals are being fortified with vitamin B6 from external sources. Next, we will discuss what happens if we have too much vitamin B6. Being a water-soluble vitamin, any unused vitamin B6 generally will exit the body through the urine. However, it is possible that a toxic level can occur from long-term, very high dosage supplementation of greater than 1 gram daily over several months. Symptoms of toxicity include neuropathy in hands and feet manifested as burning pain or altered sensation, ataxia, which refers to the loss of control of body movements, as well as nausea. Generally, symptoms usually subside after stopping the high dosage supplementation. However, in some rare cases, neuropathy can be permanent and may not be easily reversible. In summary, vitamin B6 has got 3 basic form and 3 active coenzyme form. The AGAS coenzyme are now involved in metabolism of carbohydrates, protein, and fat. They are also involved in the production of neurotransmitters, in the modulation of inflammation, and in the function of the immune system, as well as the production of red blood cell. Vitamin B6 may help protect against colorectal cancer. Vitamin B6 has also been shown to help relieve pregnancy-related nausea and vomiting. Unlike other vitamin B6, excess vitamin B6 can lead to neuropathy. Thank you very much for watching my presentation. If you like my presentation, please kindly subscribe and share. Thank you. Again, stay alive, stay safe, and stay healthy. Have a nice day. Bye-bye.